welcome back to MadeToBeWhole. This is a continuation of our discussion on plasmapheresis and options for venous access, which is getting those needles in your veins so you can have a successful procedure.
MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
All right, welcome back to the show. Last week, we talked about the exciting development of having plasmapheresis, specifically TPE or therapeutic plasma exchange in our office. I talked about my experience with it and the wonderful, wonderful benefits I've had after just 2 treatments. Thankfully for me, the whole procedure was perfectly smooth. They were able to get the needles in first time. Everything's gone great, not an issue. Not all of my family has been that lucky. So let me tell you a little bit about their experiences, not to make you afraid, but to teach you what we've learned from it and what options we have for you if you have a more difficult time with needles staying in your veins. So my son Gideon, who has been on the show and talked about his issues, he was my driving force for getting this in our office as quickly as I could. He and 3 other family members have tested positive for autoimmune encephalitis on the Cunningham panel, it was formerly called, now the autoimmune brain panel. Unfortunately, our insurance will not acknowledge autoimmune encephalitis as a diagnosis and therefore will not cover IVIG. And I can't open enroll for another 6 months. And my kid was suffering. Plasmapheresis is an alternative treatment. So we've been waiting and telling Gideon, this is it. This is it. This is going to really help turn the corner for a lot of things you're experiencing, which I do believe, but his path to getting there has not been great. So he's had trouble recently. Used to have no trouble with his veins, just doing nutrient IVs, things like that. But recently there's been increased difficulty. Like you'll get blood return and then it stops or the IV fails. And it just doesn't make sense. These veins are visible, they're palpable. They used to be not problematic at all. It's gotten trickier and trickier. So we go to do his first procedure. He's patient 0. He's the very first one and could not access his veins. Now, I will take that back. We could access them, but we could not keep them accessed. You would have blood return and flow, and then it would stop. We started running IV Benadryl to help him calm down and also to get some fluids in it, and then noticed that his chest was convulsing. So I have a video of it, but you can see his chest muscles just rhythmically spasming, and they do not stop. He's there on his phone reading while this IV is running, and I'm watching these chest muscles do that. And it occurred to me, okay, you're never going to be successful with a peripheral IV, because if this is what's happening that you can see, this is happening other places in his body, and this is probably why those IVs are good and then they're not. Because if you have got constriction of the blood vessels from the muscle spasming, or maybe there's vasoconstriction by another mechanism, you're not going to have continuous flow to be successful. So we went for option B. It's probably option X because there were a lot of things to get us to this point. Well, option B was to get midline catheters placed. So let me tell you what a midline catheter is, how that compares to other options, and the procedure for getting one. So midline catheter is similar to a PICC. A PICC is a peripherally inserted central catheter, an IV that goes in usually around that inside crease of your elbow, the antecubital space. It threads up your arm, around your shoulder toward those big blood vessels near your heart. You have to have an x-ray to confirm that it's in the right place, that sort of thing. PICCs are great. They can stay in for a long time, even up to a year, but The challenges with the PICC lines we have are they're sometimes harder to get covered if you have insurance that one's covered. It's a little more time getting them scheduled in place. And we knew for Gideon, we didn't need this to be in for months or a year. We needed it for a month because I wanted to do 5 treatments in pretty quick succession. So the midline catheters, one of the benefits of those is that they're really easy to place. They can be done outpatient. It's placed in your upper arm, kind of around your bicep area. You don't have to have an IV to verify placement. The person who did Gideon's was really, really good. So this guy, it probably, for sure, checking in, waiting, and setup took the most time. He did each arm in about 10 minutes. So the procedure was this. He used an ultrasound to find the appropriate vein. He injected some lidocaine, so lidocaine's a numbing agent, into the vein. Then he used the ultrasound again to access the vein and thread the line up. Then you have a clear dressing that goes over it. And that clear dressing can't get wet, so you have to wear a shower sleeve, whatever. We had 2 midline catheters placed because in Gideon's situation, we couldn't even get one good line for him, so we wanted one in each arm. We had to be very, very specific with placing the order. Hospitals aren't familiar with doing it this way, so the things that are super, super important, it has to be as wide of a tube as we put in. They do make 18 gauge midlines, so it needs to be an 18 gauge. If it's smaller than that, you might have gotten a procedure for no reason. And it has to be in 2 separate arms. They tried to get the ordering provider to rewrite the order for a double midline catheter because they thought, oh, they need 2 lines. A double midline will be great. But that is not great for plasmapheresis because the double midline means basically there's 2 little tubes inside one line, but we can't be pulling from the same vein we're putting blood back in. That's not going to work. We had to specify 1 midline catheter in each upper extremity, 18 gauge. That's what has to be. It was super successful. We were able to go run the procedure. He's had 2 full procedures right now. He's tolerated them well. He's had some fatigue afterwards. Not quite the die-off situation that I've had so far, but doing well, and we're keeping at it. He's had a lot of progressive symptoms, so we know it's going to take time. Well, then you have other situations like my poor husband, who, with his permission, I will share, he has adult onset autoimmune encephalitis, which I do not think is as rare as some people make it. I think it's something we're not screening for. How many people do you know who has an adult had, quote unquote, a nervous breakdown or a psychotic break, or they just crack? They have this sudden onset of anxiety or other psychiatric symptoms that is very, very different from their baseline. Now, can stress make your mental health worse? Yes. Do we have stress? Yes. But we've had a lot of stress for a long, long time. And my poor husband started very, very, very suddenly having extreme anxiety, even panic attacks, severe insomnia, feeling anxiety to the point that he was feeling afraid. This is not his personality. This is not his baseline, but it happened. And then I started noticing neurological things like twitching and jerking. And my friend who helps with the podcast said, well, I listened to a podcast that says sudden onset anxiety, you should check for this PANS PANDAS thing. So I did, and boy, oh boy, it was positive. So autoimmune encephalitis in a 53-year-old, it can happen. So he's been very, very anxious to get treatment because he's very, very anxious and doesn't want to live this way. Well, this poor fellow, he's got great veins. Both times we've done it, we've had a similar experience. You access them right away, you get good blood flow, but then the procedure fails for one or a couple of reasons. So the first time with Eric, he hadn't eaten breakfast. He hadn't really been pushing fluid the day before. We got the procedure going, but then he passed out. And so then getting him to come to, he had kind of this vagal reaction. I think that there were a lot of different things that played out, but he was all sweaty, he was all clammy, then the lines clotted. It just was not a good experience. We decided just to stop and have him come back after we had been able to run fluids first. We made sure he ate the breakfast, all these other things. So comes back for round 2, and we have a similar failure. The details a little different. You get both lines right away. Not a problem. Good blood return. You start running the procedure, and for some reason, those lines just won't hold. They're not staying like they're supposed to. So we said, okay, we know what's going on with Gideon. Maybe we've got something going on similarly with you. We made an appointment to have 2 midlines placed. Well, something I've never heard of before, they weren't able to get 2. They got 1, but the other one, there were multiple tries that failed. She just could not place the second midline. I don't know why that happened. I have speculation, but we won't even go there. He was obviously distressed. I said, hey, it's not a big deal. We can use a regular IV for your return line. We've got the midline that we can use to pull the blood from. Everything's going to be great. Not a problem. So we got a regular IV started. We ran fluids. We're all prepped. We start the procedure, and his blood just won't pull. And I don't know if it's the line or because he's having vasospasm like Gideon has, or because there's clotting, or I kind of suspect vascular inflammation because he has a different strain of Bartonella that I do. He has Bartonella henselae. Someone else in his family has tested positive for Bartonella henselae. I have a different strain of Bartonella, as do the kids. So I've started to speculate, okay, Bartonella causes vascular inflammation. If he's had this for decades, potentially, he hasn't been doing all the things that I've been doing as far as procaine, the IV anti-inflammatories and nutrients that I think maybe primed my body for success. So for my poor amazing husband, we're having to just rework our plan and our time frame. I said, this midline is not a waste. It's not a big deal. It's disappointing. We've got the midline. It's functional. We're able to give you fluids through it. Let's do IV procaine, which he did have an immediate response as far as reducing inflammation and anxiety. We did IV glutathione and vitamin C, which also had some benefits and have made his symptoms manageable. So in this case, we've had to kind of rework our treatment plan and timeline because things didn't go as expected. Even though it was a really, really great plan that worked well for Gideon, it didn't work well for Eric. There's that initial kind of like grief and anger and what's happening to me. And it's terrible because when things like this happen to people who are already suffering, like the reason you need this treatment is because you don't have emotional tools because your brain is on fire and it's being attacked. And then you have difficult things happen, but you have a much harder time processing them and coping, and you have a hard time not feeling hopeless. So I would encourage you, first of all, to have hope because there's always an alternative. But I would also encourage family members to help be the voice of reason. You have to give comfort because it sucks. This is terrible. But you have to stay calm and give reassurance that no, this is not hopeless. This is not the end. We will keep looking for answers because this is what we do. You will get better. If you get anxious and excited because they're anxious and overwhelmed, first of all, you're going to feed your family members anxiety and they're going to say, oh, look at what mom or dad or my spouse is saying and doing. It's so bad. They're this stressed. It must be true. I'm never going to get well. That is not helping your family member. You might feel that way, but you need to hold your crap together and have your meltdown somewhere else out of their presence because they need you to be calm. They need you to problem solve. This is not something that's being done to you. It's just something that's happening. So options for Eric. The midline's there, so we're just using it for the month that it's there. We're doing IV anti-inflammatories, IV nutrients, everything we can to prime his body to be able to do better with treatment. Now, if we get things managed, we have a couple of different options. Like in our case, we could say, hey, maybe we just put this off until we can change insurance, see if we can get the IVIG approved, go that route, and then retry plasmapheresis. Or if we want to continue to go the plasmapheresis route, there are plasmapheresis ports. So not all ports are created equal, and your regular port, my son Daniel has one, is great for regular IVs and for putting things in you. It's not great as an access point for pulling blood out of you for plasmapheresis, because the needles that you need to use are so big, they're going to damage the pad that's on that port. And you want that port to have longevity because you had to have a minor surgery to have it placed. So there are these power flow ports. It's not the same as a power port. These power flow ports that instead of having this pad that's the access point for your needle, it's like a metal tunnel. And it looks literally like a funnel that you can put a larger apheresis needle in and very successfully pull blood from that for the procedure. And again, a port can stay in for months and then removed, or if it's something you want to keep in longer so that you have access for future treatment, for IVs, for blood draws, it can stay in longer. You just need once a month to access it and flush it and that sort of thing to keep it going. But it was interesting. Eric told me, I think it was this morning, he said, yeah, those plasmapheresis ports that you're talking about, that's probably what I'm going to have eventually. And I said, yeah, it probably is. But pay attention to the timing. If I would have, when I was trying to comfort him when he's having a panic attack because things aren't working and he feels awful, to say, no, it's going to work out. We can do this, 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 and this. When people are in that state, they can't deal with all those options and problem solving. They just need comfort and clear direction. So even going and getting that one regular IV placed once he had his midline, he was pretty anxious about, not because he used to be anxious, but because it went so poorly before. And when you're anxious, and a lot of us have helped this before, you feel like a little kid. You can't problem solve. You're stressed. And so I had to say, and this is my husband, he's a grown up, but I know what it's like to feel that. I had to say, okay, this nurse is going to put in this other line. She's very, very good. She's going to try one time. If it does not work, we will not try again. And so if you can give clear directions and boundaries so they know, okay, I've acknowledged what you've gone through and what you are going through, and I'm taking that into account. I'm making a decision because I care about you and I want you better. But here are the limits. You're not going to get poked lots of times, because if there's not success on the first poke, we're calling it and we'll find a different option. So I think knowing when to show up with which part of the solution is important, but it's hard. It's a work of art. Sometimes you don't know until you start talking and you see the person's face that this is not the thing I should be bringing up right now. What do they need right now? And I think it's also important to remember for encephalitis that when people act out or in a flare, they are not doing this to you. It's something that's happening to them that's changing their ability to problem solve and to cope and to be appropriate. Now, I will also say that does not take accountability away from people and the decisions they make. You have to let people know that things are hard, that you might not be your best self, you don't have all the best problem solving abilities, yada, 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 but it doesn't give you then an excuse to be violent. It doesn't give you an excuse to do or say inappropriate things. If some of those things slip, you accept accountability and apologize. It's a really, really tenuous balance, because I completely acknowledge that what's going on in your body and your brain, this is not you. And it's not personal at the same time if somebody does act different than their best self, but you still have to make good, safe choices. And you have to figure out, what do you need to do if you're feeling that way so that you have support, but you're not putting other people at risk emotionally or physically. You know, I've mentioned before on the show, and it's with his permission, but Daniel, my son, who has autoimmune encephalitis, who knowing what I know now, has probably had it for decades, but remembers even as a young child having these violent impulses to hurt me, to push me down the stairs, and having to like physically restrain himself because he didn't want to, but that was the impulse. So recognizing what an exhausting state of being that's in. Sometimes you may say, oh, gosh, they're a little grouchy. They shouldn't be that way. They shouldn't be short. But you may not know what all they're having to put into just holding it together and just stopping themselves from hurting someone, because that's what the impulse is. Even though they're a good person and they love you and they don't want to hurt you, they feel afraid and like a stranger in their own body. So takeaways from this jumbled account of the last few weeks and few months in our family is that there are multiple options for venous access. If you come to our clinic for therapeutic plasma exchange or plasmapheresis, you'll meet with a nurse before you have the procedure on a different day so that they can look at your veins and they can take your history and they can decide, is this person a good candidate to use these plasmapheresis needles? Just access them in the office. For many people, it's going to be fine. But if you have got an overactive nervous system, if you've got vascular inflammation, if you have a history of really, really tough blood draws, we want to increase your chances for successful treatment. So maybe we can make some decisions ahead of time about what the best way to move forward will be. There are also some labs that need done prior to your procedure because, for example, hematocrit and hemoglobin are part of your CBC, your complete blood count. Well, that affects how much the rate of the plasma exchange and everything that goes on. We use that to calculate how much you get and how the procedures run. Just some very, very basic safety labs, but a lot of it is going to be history taking, looking at those labs. The other takeaway from this is that adult onset autoimmune encephalitis is a thing. That is another reason why I really, really prefer using that phrase over PANS PANDAS. PANS PANDAS is way easier to say, okay? But the difficulty with that, PANS PANDAS, the P in both of those acronyms stands for pediatric. My husband is not a pediatric patient. He's in his 50s. It's not pediatric. And so it kind of fuels the misinformation that this is something that is not only rare, but it only happens in children. You can have autoimmune things happen at any stage in life. Think about other autoimmune disorders that you're aware of. Some people get them in childhood, but some people get them in adulthood. You can get type 1 diabetes in adulthood. You can get autoimmune thyroid disease in adulthood, rheumatoid arthritis frequently in adulthood. Think of anything you've ever heard of that's autoimmune. You know adults who have developed that. Why would autoimmune encephalitis be any different? So autoimmunity is kind of this broad umbrella, but it manifests itself in different ways based on genetics, but also exposure. You know, you might be more prone to autoimmune encephalitis versus other things if you have an infection like Bartonella that can cross the blood-brain barrier. That would make a lot of sense. So have an open eye, an open mind, and an open heart when you're dealing with these things. Be aware that even though I feel like counseling can have some really, really good benefits, it's difficult to engage in counseling for regular life stuff, but there are a lot of people who do not understand these illnesses and how they affect you. And so you really, really want to do your due diligence in finding someone that you trust and at least has some awareness of encephalitis and how it can affect you and is open to the other treatments and things that you're doing. That encephalitis related OCD is not going to respond to traditional treatments and counseling methods for OCD in an encephalitis patient because they have encephalitis, they have infection in their brain, autoimmunity, and something that triggered it, a toxin, an infection, something. All of those things have to be addressed. One option for people who are patients at AHP that I'm excited about, there are a lot of people in life who have some degree of what I will call medical PTSD. They have been hurt by the healthcare system. They've been discounted by the healthcare system, including the mental health system, and they have real reservations about going to other people, going to other counselors, other healthcare providers. They just feel afraid, and for good reason. You're not weak. People have been hurt and mistreated and misunderstood and not listened to, and it's perfectly reasonable. So one of the ways that I think our new coaching program can assist with that, our coaches are not counselors, they're not licensed counselors, is not meant to take the place of that. But if you have encephalitis or some other issue that you might not be ready for counseling for, but you just need some support, you need someone to check in on your safety, help talk you through what you're going through. The coaches can fill some of that gap until you are ready for counseling or find someone that works for you. Or maybe that just helps fill the need because it's mostly support that you need. So the sorts of things that they can do for you, sometimes it's just listening, but sometimes it's helping keep accountable with goals, helping you talk through and problem solve, because when your brain's on fire, basic decisions become hard. And so sometimes you may have a challenge that seems insurmountable, but just having someone to talk to who understands what you're going through, you can come up with better solutions, helping you figure out how to manage your pills because you can't even decide what to wear in the morning, let alone figure out which bottles to open at what time, or maybe help you just be an accountability partner if you are really working on leaving your house even though it's scary to, or working on impulsivity, or not lashing out at family when you have a flare, whatever it is. They're not counselors, but it could be a stepping stone for having a trained, supportive person to help guide you through the process. And then remembering that we do now have a counselor at AHP. So that is somebody who is familiar with these infections and their impact, and there's not going to be gaslighting. If you have found counselors that you think are really great and have been supportive, shoot us a message, because we're always trying to create lists of resources for our patients. We know that it's a long road, and some of our best information comes from our patients and their lived experiences. So share what you have. Don't be afraid to reach out and get help no matter what age. Don't accept the diagnosis of a sudden onset mental illness and a lifetime of psychiatric medications that may not be effective and can do long-term harm if you haven't done your due diligence for figuring out what started this. Things like this don't just happen. There's an instigating cause, and you need to look at all your information to figure out what it is so that you can get to the root of it and hasten your healing. So remember, there are always answers, and to never give up and have hope, because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.